Well, we all want to turn back the clock when it comes to aging, but Dr. Doris Day says it's also important to see the beauty in yourself as we get older. She has a new book. It's called Beyond Beautiful.
Yeah, it's all about understanding the connections between how you look and your overall health and well-being. She joins us now. Dr. Doris Day, good morning to you.
Good morning. Thanks for having me.
So this is really all about, beauty comes from within.
It does. It's both within and without. Appearance has value, and it's not just superficial.
Right.
And after 20 years in practice and seeing so many people come through with so many incredible stories, what I've learned is that there's always a story behind the appearance. And the mind and the body, they're not just connected, they're actually one. Your appearance reflects both your emotional well-being and your overall health. So there's so much a dermatologist can tell about you just by looking at your skin, your facial expressions, and your mannerisms. So what I try to do is tell a lot of these stories, starting with my own, of course, and that's the intro. And then as I go through, I help you understand whether it's hair loss that you're suffering from, or if you see yourself aging around your eyes or your mouth, or if it's something on the body or a rash when it comes out. It's never by accident that things come up where they do, when they do. And when you understand that connection, anything I do to make it better will look better and last longer.
So tell us about your story so the viewers would know where you started and where you are now and why it's such a 360 moment for you.
Well, I started out as a medical journalist, then I did internal medicine, then dermatology. But my story kind of starts in my own childhood of loss, of losing my sister to cancer at a very young age as we were teenagers. And I really felt responsible. And I just wanted to see myself age. I wanted to see myself age around my eyes. That was like my area where I focused on. And then I noticed in patients a lot of times when they had issues around their eyes, it was about things they wanted to see or didn't want to see about themselves. And a lot of times that can come out in a rash because you're rubbing your eyes. And there might be an allergy or an irritant reaction behind it. And of course we have to treat it. But understanding the source of how you see yourself, whether it's around your mouth. Hair loss has a lot of history behind it. And for me, my other part of my story is that my dad is a physician, and I learned so much from him. He had a lot of Eastern Western, so a lot of what I learned was about the power of hypnosis and meditation and a lot of non-traditional Westernized medicine kind of protocols to help people feel better, look better, and be healthier.
So what does, hair loss obviously is a big problem. It leads to a lot of insecurity for both men and women. So what is this indicative of?
Hair loss can be a lot of times medical, right? So there can be autoimmune issues, there can be stress issues, hormonal changes like after childbirth, things like that. So it's not that you don't take the medical side seriously, but if you look at the emotional side behind it, a lot of times this is after PRP for hair regrowth in someone who had a genetic pattern of hair loss, and it works amazing along with supplements and some topicals. So there's a whole program to help regrow hair. So my point is that there's things we have to do medically, but on the emotional side, a lot of times what I see as a pattern of people who have hair loss is that they tend to be very bright, overachievers, but they're also pleasers. And it's almost like you're being pulled in too many directions at a time. And that's why it comes out in your hair, not as a rash, not as an ulcer, not as something else. So when you learn to be more centered around yourself, meaning that you're not selfish and saying everyone else has to please me, but you're centered and knowing that you're responsible for your own happiness and your own well-being, first and foremost, a lot of times whatever else I do to help the hair grow back works better and lasts longer.
I mean, hair loss is such an issue that so many people deal with. So let's show another before and after. You mentioned PRP. Tell us about what is PRP and how do you get that?
So PRP is a treatment that we do in the office where we take some blood and then we spin it down, extract out the red blood cells, and we keep the platelet-rich plasma, which is like pure gold. It's actually golden color. And then we inject that back into the scalp, and it helps provide growth factors that supports hair growth.
Wow. So who's the ideal candidate for something like this?
Someone who has either what's called a chronic telogen effluvium, where they have just chronic stress that makes their hair shed quickly. But the perfect candidate is someone who has a genetic pattern of hair loss. If you have an autoimmune pattern where you have discrete patches of hair loss, it's not ideal for that person. And also, we try other methods first. Anything with hair has to be done over time for now until we come up with a better way to treat it more permanently, but it does work.
There's so much that we do for facial rejuvenation. What about the hands as well? We don't really talk too much about hands.
Oh, I have the hands of a farmer.
Your hands are beautiful.
Our hands really can age us. They can make us look a lot older than we are.
Actually, studies looking at hands without showing the face, people looking at them could tell someone's age better than even from their face, because there's a lot we can do for the face. Well, now there's FDA-approved treatments to rejuvenate and add volume back into the hands. And this is a hand of an 80-year-old that was like skin and bones, and then this is immediately after. You can see that there's greater volume. And then we have lasers that are now fractionated, so they're much safer to use off body. So instead of just like burning off the entire layer of the skin, we treat spots within that spot and leaving ridges of normal skin to help it heal. This makes it much safer in areas off face, so those brown spots left on the hands. And then there's, of course, skincare. Nothing matters if you don't do sun protection and proper skincare.
Right.
That's first and foremost, and always the first thing I talk about. And you know what? Now there's really no excuse to not have great skin, because the drugstore brands, like, you know, the major brands that you find in your drugstore have so much science and data behind it. There are major scientists and PhDs working for these companies to develop skincare products that are very cost effective and affordable, that can help protect your skin against sun damage and reverse a lot of the damage that's done.
Sun damage.
So,
you and I mean, Suki and I have these conversations all the time about, you know, sunspots, melasma too. It's called the pregnancy mask.
Right, that's a problem.
Exactly. It can be a big problem.
And that has to be treated carefully by your dermatologist. If you're going to have any of these treatments, do see your board-certified, aesthetically trained dermatologist or plastic surgeon for these treatments. You know, the treatments are considered safe if they're done well, but there's two things. There's one, the product itself, that may be safe if done properly, but then there's the aesthetic eye of the person doing it, and that takes decades and, you know, years and years of training to know how to assess a person, to know what they need, and it's something that it's not the place to cut corners. See the right person to have the treatment done.
Well, awesome. The book is phenomenal. It's chock full of information, talking about the whole mind, body, the whole holistic experience, along with a great doctor can take you to beyond beautiful. Thank you.
Thanks. Thank you for having me.
All right, the book is now available, and you can get it right now. Dr. Doris Day, thank you so much.
Thank you. All right, still much more to